My name is Britt Spears. I'm a certified prosthetist and a fellow of the American Academy of Orthotists and Prosthetists. Today we're going to discuss prosthesis and funding for prosthesis. As you well know, prosthesis are very expensive and they are funded in several different ways. The majority of ways that they are through insurance. Insurance can be either public, which would be government assisted, which would be an example, Medicare, Medicaid, or vocational rehab, which is through the state, or it can be through private insurances, such as an example would be Blue Cross Blue Shield, Humana. There are other insurances out there. Another form of payment would be workers' compensation, or it could also be through automobile insurances, or it could be through an automobile insurance at no fault of your own. The majority of the time, whenever you have other than workers' compensation or the automobile plans, there will be some form of a deductible. A deductible is the minimum payment that you must meet before the insurance starts kicking into the provider, which a prosthetist or prosthetic company would be the provider. So somewhere along the line that will be met before the insurance will kick in. You are supposed to pay your deductible, and when it is in regard to your insurance, it is a requirement of all prosthetic companies to collect deductibles, as it is against the law in many states. And it is against the federal law if you don't pay your deductible for Medicare or even Medicaid. Most insurances also have a certain percentage that they will pay for the total cost of a prosthesis. Usually, for example, on Medicare, they will pay up to 80% of the total cost of a prosthesis. So the 20% is due from the patient. If you do not have a secondary insurance which covers prosthetic care, then you as a patient are responsible for that 20% payment. Most prosthetic companies, including our own, can set up payment plans for that. Generally, a payment plan is we collect 1/3 of the 20% at the initial fitting, and then we collect the 2/3 at delivery time. There are other ways of paying for prosthesis. There are credit card companies that do healthcare financing. Some of them include Care Credit, for example. They will pay up to $35,000 for a prosthesis, and usually will, if qualified, to take and be a part of the Care Credit scheme of payment. They will allow you up to 4 years to pay for that. It all depends on your income, your credit rating, and other things. And as we all know, the economy is tightened up, so that is another issue. The last form of payment available for that is if you are independently wealthy. As we all know, very few of us could possibly pull out the money from a bank account for prosthesis. Now, with that said, prosthetic companies such as my own, we do finance totally for a prosthesis. It all depends on your credit rating and your ability to pay as well. We will generally take 1/3 down at the initial measurement. The next third would be at the first fitting, and the last third will be at the delivery. That's the end of today's discussion on prosthesis and financing for them. We'll continue on with the series. Thank you.